everyone, and welcome to another ICD 10 Coding Guidelines Review session. Today, we are still climbing our way through our Section 1, Letter C, Chapter-Specific Guidelines. Today, we're going to focus on Chapter 15, which is Pregnancy, Childbirth, and the Peripartum, which falls under code family of O00 through O9A. To begin, we're going to look at some general rules for obstetric cases. Number one, guys, these codes are only for the mother's record, never placed on the newborn's record. The mother's record is known as the maternal record. Additionally, these codes, Chapter 15, have sequencing priority over codes from other chapters. However, you may use additional codes from other chapters in conjunction with the Chapter 15 codes to provide further specificity regarding a condition. Should the provider document that the pregnancy is incidental to the encounter, you should use code Z33.1 for pregnancy state incidental instead of a Chapter 15 code. It is the provider's responsibility to state that the condition is not affecting the pregnancy. Next up, still talking about general rules, and majority of the codes in Chapter 15 have a final character indicating the trimester of the pregnancy. The time frames for the trimesters are actually at the beginning of Chapter 15 in your tabular list. If trimester is not a component of a code, it is because that specific condition always occurs in a particular trimester, or the concept of trimester of pregnancy is not available as an option. Certain codes have characters only for certain trimesters because those conditions don't occur in all trimesters, but it may occur in more than just one trimester. Assignment of the final character for trimester has to be based on the provider's documentation of the trimester, which they can also list the number of weeks. And this applies to the assignment of the trimester for pre-existing conditions as well as those that develop due to the pregnancy. The provider's documentation of the number of weeks may be used to assign the appropriate code identifying the trimester. Of note, when the delivery occurs during the current admission, and there is an in childbirth option for that obstetric condition that's being coded, the in childbirth code should be assigned instead. Now, let's talk about situations where the patient is admitted to the hospital of complications of pregnancy in one trimester, but then remains in the hospital into a subsequent trimester. The trimester for the antepartum complication code should be assigned based on when the complication developed, not the trimester at the time of discharge. So if they come in today and they have a condition and they're in their second trimester, and then tomorrow or 2 days from now, they're discharged and are in a different trimester, guidelines state you want to report based upon the trimester when the condition developed. If the condition developed prior to the current admission or represents a pre-existing condition, the trimester character for the trimester at the time of the admission should be assigned. Now, we do have a category in each code family that says unspecified trimester. Unspecified trimester code should rarely be used, such as when the documentation in the record is insufficient to determine the trimester and it's not possible to obtain clarification. All right, next up, the seventh character for fetus identification. I have to say that this has to be one of my most favorite rules regarding coding, because in our mind, we're like, oh, there's one fetus, so it should be a seventh character of 1. But that's not true. Here are the rules, guys. Where applicable, a seventh character is to be assigned for certain categories, and those categories, they're represented in the guidelines, to identify the fetus for which the complication code applies. Watch this, guys. Assign a seventh character of 0 for single gestations, when the documentation in the record is insufficient to determine the fetus that was affected, and it's not possible, watch this, not possible to obtain clarification, or when it is not possible to clinically determine which fetus is affected. Then after that, guys, you follow the seventh character designation. But I think it's important to note, 0 is for single gestation. All right, guys, let's look at selection of OB, principal or first listed. So first, in situations where we have routine outpatient prenatal visits, this is when mom is just coming in, no complications are present, and they're just doing their regular OB visit. Here, you're going to use a code from category Z34, which is Encounter for Supervision of Normal Pregnancy. These codes should not be reported in conjunction with a code from Chapter 15. And I want you to think about this, because you're essentially saying Z34, visit, no complications. When you add a Chapter 15 code on, you're saying that there's some type of complication. All right, next up, supervision for high-risk pregnancy. This is code family 009, and these codes are only to be used during the prenatal period. For complications during the labor or delivery episode as a result of high-risk pregnancy, we're going to assign an applicable Chapter 15 code, but not 009. If there are no complications during the labor, we're going to assign a normal delivery code, which is 080. Now, for routine prenatal outpatient visits, and I know, guys, with this, there's a lot of rules, inpatient, outpatient. So for prenatal outpatient visits for patients with high-risk pregnancy, we're going to assign a code from 009 as the first listed code. Now, if the patient has any other issues, you're going to use secondary codes from Chapter 15 to demonstrate those particular complications. All right, so let's say you have an episode where no delivery occurs. In this situation, the principal diagnosis should correspond to the principal complication of the pregnancy that resulted in the patient coming to us today. They came to us today because they had a problem, they left pregnant. They came in pregnant, they left pregnant. So principal is the complication that brought them in. Now, should there be more than one complication, all of those complications, if they were treated or monitored, they should be sequenced first, all right? Now, what happens when a delivery does occur? The condition that prompted the admission should be principal. If multiple conditions prompted the admission, you're going to sequence the one that's most closely related to your delivery as principal. A code for any complication should be secondary. In the cases of a C-section, if the patient was admitted with a condition that resulted in the performance of a C-section, that condition, guys, should be first. And that makes sense, right? They had a C-section. This is the reason why the physician had to do a C-section. Now, if the reason for admission was actually unrelated to the condition that resulted in the C-section, that condition should be selected as principal. All right, last guideline here is related to outcome of delivery. I want to remind you, we're talking about the mother's record. A code from category Z37, outcome of delivery, should be included on every mother's record. These codes do not go on the newborn's record. And I'll talk about newborns in a different video. Today, it's all about mom. Next up, pre-existing conditions versus those conditions that are due to the pregnancy. So Chapter 15 codes actually distinguish between conditions of the mother that were present prior to the pregnancy, aka pre-existing, and those that are a direct result of the pregnancy. When you are assigning codes from Chapter 15, it is important to determine if the condition was pre-existing, which means prior to the pregnancy, or developed or were due to the pregnancy in order to assign the correct code. In those instances where you have a category that does not distinguish between pre-existing or pregnancy related, the conditions may be used for either or. It is acceptable to use codes specifically for the peripartum with codes complicating the pregnancy and childbirth if the condition arises during the postpartum, during delivery. All right, next up. Guess I was getting too excited about that. Pre-existing hypertension in pregnancy. And here we actually have a code 0 or 010, which is pre-existing hypertension complicating the pregnancy. And guess what, guys? You probably are wondering, do these codes include codes for hypertension heart and hypertension CKD? Yes, they actually do. When assigning one of these 010 codes that includes hypertensive heart, hypertensive CKD, it is necessary to add a secondary code from those appropriate code families to specify the type of heart failure or the type of CKD. And in a previous video, guys, I went over hypertensive heart, hypertensive CKD, so I know you are familiar. Next up, we have fetal conditions affecting the management of the mother. Let me just remind you, right now, we're only talking about the mother. We're only coding for the mother. So first we have codes 035 and 036. These are specifically for situations when the fetal condition is actually responsible for modifying the management of the mother. And what we mean by modifying the management is requiring diagnostic studies, additional observations, special care, or guys, even termination of the pregnancy. The fact that the fetal condition exists does not justify assigning a code from this series to the mother's record. We have to see in the record that the condition itself is actually responsible for modifying the management of the mom. In utero surgery, this is category 035. So if you have surgery performed on the uterus, we're going to use code 035, which is maternal care for known or suspected fetal abnormality and damage. This is assigned identifying the fetal condition, and then of course you're going to have a procedure code for the actual procedure itself that was being performed. Reminder, we are coding for mom, so no code from chapter 16. Perinatal code should be assigned on the mother's record to identify fetal condition. Remember, surgery performed in utero on a fetus is still coded as an obstetric encounter. All right, guys, HIV and pregnancy. We actually have talked about this before. So in our pregnancy section, we do have a code 098.7, which is human immunodeficiency disease complicating the pregnancy, the childbirth, and the puerperium. Now, in terms of what you're coding, we're still going to follow our coding rules, except we got a pregnancy code that's going to be sequenced first. So it doesn't matter if the patient is symptomatic or asymptomatic, we're always going to use 098.7 if they have AIDS or HIV positive. Now, in the cases where they have full-blown HIV disease, which as you know is a situation when the patient has had or currently has an opportunistic infection, you're going to use B20, followed by a code for the related illness. Now, if they're just HIV positive, no current or previous opportunistic infections, you're going to use Z21 as your secondary code. Diabetes and pregnancy. So diabetes is actually a significant complicating factor in pregnancy, and pregnant women who are diabetic should be assigned a code from category 024, which is diabetes and pregnancy, followed by the appropriate diabetes code from chapter 4. And that's because the pregnancy code doesn't get into specifics about the patient's actual diabetes like the chapter 4 codes do. Now, if the patient is taking long-term use of insulin or oral hypoglycemics, you'll want to go back and review your chapter 4 guidelines on long-term use of insulin and hypoglycemic. Now, we do have patients that have pregnancy-induced diabetes, and that's known as gestational diabetes. Gestational diabetes can occur during the second and third trimester in patients who are not pregnant. Gestational diabetes can give complication in the pregnancy similar to those that have pre-existing diagnoses of diabetes. It also puts the patient at greater risk for developing diabetes after pregnancy. We have codes 024.4 for gestational diabetes. Of note, no other code from category 024 should be used with the code 4024. Why? These codes include things like diet controlled, insulin controlled, controlled by oral hypoglycemic drugs. All of that's included in the code family. If the patient with gestational diabetes is treated with both diet and insulin, only code insulin controlled. If their diabetes is treated with diet and oral, you're only going to code controlled by oral hypoglycemic. Now, remember those codes Z79.4, long-term use of insulin, Z79.84, long-term use of oral hypoglycemics? Those, again, should not be used with these codes. Side note, if a patient has an abnormal glucose tolerance test in pregnancy, there's a code for that, and that's called 099.81, which is abnormal glucose complicating the pregnancy. Sepsis and septic shock in pregnancy. When you are assigning a code from chapter 15 for sepsis that's complicating either an abortion, pregnancy, childbirth, preparium, a code for the specific type of infection should actually be assigned as an additional diagnosis. In those cases where severe sepsis is present, you're going to use a code R65.2. You're familiar with that code for and that's for severe sepsis, and a code for, the associated organ dysfunction. You remember that from Chapter 1 guidelines. Puerperal sepsis. Puerperal sepsis, which is code family 085, should be assigned with the secondary code to identify the organism that's impacting the patient, and we know those organisms are found in B95 and B96. Also, a code from category A40 or A41, which are streptococcal sepsis and other sepsis respectively, should not be used with puerperal sepsis. And if applicable, if your patient has severe sepsis, you're going to use R65.2. And of course, if they have an acute organ dysfunction, you're going to capture that code as well. All right, next up, alcohol, tobacco, and drug use. Now, the way ICD-10 is set up it's so structured. I love ICD-10. We have codes that identify alcohol 099.31, tobacco 099.33, drug 099.32, use in a patient that's pregnant. In terms of sequencing, of course, pregnancy codes have sequencing priority, and if they are using alcohol or drugs or tobacco, you're going to sequence first the pregnancy code, and then you're going to have a secondary code for those related conditions. All right, and the codes are listed here for you. They're also in the guidelines. All right, next up, pregnancy, toxic effects, adverse effects, and underdosing in a pregnant patient. We got some sequencing rules here. Of course, our pregnancy code, which is 098.2, which says injury in pregnancy, should be sequenced first, followed by the appropriate injury or poisoning code, and then an additional code, a third code, or codes, because it could be more than one condition, that specifies the condition that was caused by the poisoning, the toxic effects, adverse effects, or underdosing. Almost done, guys, here. This was a long one, right? Next up, normal delivery. So we have a code, normal delivery, code 080, which should be assigned when a woman is admitted for, very important, full-term normal delivery, full-term, very important. Also, single healthy infant without any complications, antepartum, during the delivery, and postpartum during the delivery episode. Code 080 is always going to be principal. Because we're saying that this is uncomplicated, no complications, it should not be used with any other code from Chapter 15, okay? Additional codes from other chapters may be used if they are not related to or in any way complicating the pregnancy. You don't want to contradict your code by saying, oh, it's uncomplicated, but here are some complications, okay? Now, code 080 may be used if the patient had a complication at some point during the pregnancy, but the complication is not present during the time of the delivery. On the mommy's record, we're still talking about the mommy's record, we're going to use an outcome of delivery code, which is code Z37.0, which says single live birth. Why? Remember, if we're using 080, uncomplicated delivery, they have to be full term. It has to be a single, no complications. All right, next up, the peripartum and postpartum periods. So peripartum and postpartum. Peripartum begins immediately after postpartum. Make sure I got that correct. Postpartum begins immediately after delivery and continues for 6 weeks following delivery. And then peripartum is defined as the last month of pregnancy to 5 months postpartum. So make sure you remember those dates. Any postpartum condition or a postpartum complication, I should say, is any complication that's occurring within the 6-week period. Now, Chapter 15 codes may also be used to describe pregnancy-related complications even after the peripartum or postpartum period, but we rely on the provider to document that that condition is pregnancy-related. In those situations where the mom delivers outside of the hospital prior to admission, like in the cab, and they come in for routine postpartum care, no complications are noted, we have code Z39.0 that is used for care and examination of the mother immediately after delivery. That should be your principle. And in those situations, guys, we're almost done. In those situations where mom has a pregnancy-associated cardiomyopathy, there is a code 090.3. It's unique in that this is diagnosed in the 3rd trimester of pregnancy, but it can actually continue after delivery. For this reason, this code in its description is defined as peripartum cardiomyopathy. Remember, peripartum period is defined as the last month of pregnancy to 5 months postpartum. One note about this code 090.3, it's only for use when the cardiomyopathy develops as a result of the pregnancy in a woman who did not have a pre-existing heart condition. All right, sequela of complications of pregnancy. So we have code 094, which is for use in those cases when an initial complication of pregnancy develops a sequela, the sequel, the late effect, requiring care or treatment at a future date. This code can be used at any time after the initial postpartum period, and like all the rest of the sequela codes, it is to be sequenced following the code describing the sequela of the complication. Termination of pregnancy and spontaneous abortion. We got 3 guidelines to be concerned with here. So first, when an attempted termination of pregnancy results in a live-born fetus, we have code Z33.2, which basically says encounter for elective termination of pregnancy. And because a live-born fetus was the result, you're going to use a code from the Z37 category to show the outcome of delivery. Remember, we're still talking about the mom's record. Next video lecture, guys, we'll look at the baby's record. All right, retain POC or products of conception following an abortion. Subsequent encounters for the retained products of conception following a spontaneous abortion or elective termination of pregnancy without complications are assigned to either 003.4, incomplete spontaneous abortion without complication, or 007.4, which is a failed attempt termination of pregnancy, again, without complication. This guidance is actually appropriate even when the patient was previously discharged with the diagnosis of complete abortion, okay? Because if the patient had a specific complication with the associated abortion or elective termination that results in retained products of conception, we have to assign the appropriate code. And complications that are leading to an abortion. Codes in this chapter, which again is chapter 15, may be used as additional codes to identify any complications of pregnancy in addition to codes from categories 004 or 004, 007, and 008. 8. And lastly, guys, abuse in a patient that is pregnant. So as it relates to abuse in a patient that's pregnant, we have 3 code options. 09A.3, physical abuse complicating the pregnancy. 09A.4, sexual abuse complicating the pregnancy. 09A.5, psychological abuse complicating the pregnancy. And just so you know, all of these codes are complicating pregnancy, childbirth, and the puerperium. So these codes, if they apply, should be sequenced first, followed by the appropriate codes to identify any associated current injury that's due to the physical abuse, the sexual abuse, as well as the perpetrator of the abuse. All right, guys, this has been your Chapter 15 review for pregnancy. Next up, guys, we have Chapter 16, conditions that are originating in the perinatal period. Happy coding!